Hey guys, welcome back for another edition. This is going to be one of a series. We are lucky enough to have Dr. Brent Agin with us today. Thank you, Brent. I've known Dr. Agin for a long time, and he has moved in from doing traditional medicine to really looking at what I call functional medicine, how to make people more healthy, more fit, without using high doses of prescription medications or other things. He's really been a pioneer on this, and it's really worked well. So what we want to talk about today, Brent, is this new trend in medicine that scares a lot of people dealing with a drug called ketamine. Now, before going forward, I also want to let people know when we're talking about these drugs and the interactions, Brent, besides being a physician who really knows this, he was the medical director of a drug rehab facility, detox facility, for
almost 16 years.
Almost 16 years. So when we're talking about prescription medications and people getting hooked, and Brent's seen the worst of it through all these years of detox, part of his practice has always been trying to get people away from those and to other alternatives that are safer. For us out there, what's ketamine?
Yeah, so just to recap, so functional medicine is exactly what you said, and the importance of using non-traditional therapies or alternative therapies is the idea of functional enhancement. So it's anything that can enhance the function or quality of life that people can have, as well as reduce the risk of disease. And so it's very preventative oriented. So ketamine has been a blessing for functional medicine doctors because ketamine came out in the 60s, but it wasn't until 1970 that it got actually approved as an anesthetic. And it's what's called a dissociative anesthetic. And so it's one of the safest drugs. In 1985, it was termed the essential drug by the World Health Organization, but it wasn't until the 90s that they started using the drug for PTSD in the military. Not only were they testing in the military coming back from combat, but they also started to look at it as actually a stress retardant before they were deployed. And so they were looking at ketamine in the late 90s, but it wasn't until the early 2000s, 2005, that I started finding that doctors across the country, psychiatrists, were using it for treatment-resistant depression. So I started looking at it for that use at around 2010.
Okay.
But it's an anesthetic, but the way it works in the brain is that it works on the areas of brain that manages stress. It basically works sympathetic and parasympathetic nervous system.
I'm sure. Now, I want to get to all that, but what you were talking about for PTSD and medication resistant depression and things like that, that's what they call in your medical, like the off-label uses, correct?
Well, 2019, they did get FDA approval for Spravato, which is a ketamine nasal spray. And that kind of opened the door saying, wow, all right, so anybody that was interested in psychedelic medicine or any sort of alternative medicines for the brain got excited because now we had our first option. The first one was medical marijuana, but not a true psychedelic. So ketamine was the start. Now all of a sudden we had this opportunity. They had an FDA approved nasal spray. So we are using the infusion off-label for the treatment of depression.
Okay. And you said that there's, for depression, for PTSD, what other, quote, off-label uses are these infusions of ketamine being used for besides those mental?
The majority of physicians doing ketamine right now are psychiatrists or psychiatry, some sort of mental illness centers, even a little bit maybe in substance abuse. So me being a functional medicine doctor and using it, yes, I'm using it for depression, but as you can imagine, I don't get that much depression in regular patients. But with doing ketamine infusions, I've got suicidal clients, I've got people with PTSD, major histories of clinical depression, social agoraphobia, various anxiety disorders. But what I like is that I've been seeing such important benefits for those with post-concussion syndrome, traumatic brain injuries, any neurodegenerative disease, cognitive decline, memory loss, focus, high family histories of neurological disease like Alzheimer's, migraines, phantom limb, chronic regional pain syndrome, anything that has to do with the nervous system, which basically a brain, obviously the nervous system commands the body. So you can see that there's really nothing that potentially could be helped with ketamine per se, but there are a couple conditions that you have to have some considerations, which is mostly schizophrenia or people that are on a lot of psychiatric medicines.
You talked about chronic regional pain syndrome. It used to be called RSD back in the day.
Yeah.
And we have a lot of people now that are having these accidents, failed back syndrome, things like that have all this chronic pain, even some of them through some rheumatological conditions. And it seems like some doctors are just, here's your opioid, here's your opioids, here's your opioids. Does ketamine help with those chronic pain situations?
Yeah, there's two different ways you can deliver ketamine. One of them is you can do, which some of the pain management doctors will do, they'll do a full anesthesia. They'll put you in, bring you into the clinic. They put you on a higher dose of ketamine, but they also use something like Versed, conscious sedation. So you're basically out. So they can do much higher doses, but yet it's still not eliminating pain. So even in our setting where we might do an hour infusion or a 3-hour infusion at a higher dose, two things happen. Is one, the pain goes away. While they're getting the anesthetic, their pain is gone. Sometimes can last up to 48 to 72 hours. But think also is the depression and anxiety and just mental component of chronic pain. So when these people are getting an infusion and they're not out like under anesthesia, a 3-hour drip, their pain's gone, but they're also getting that little bit of antidepressant effect of ketamine. And so it's a twofold treatment. So these people walk out with this mental break finally that they were able to break this cycle of pain. So for a while they have no pain. And that's huge for anyone that has pain every day.
And that's through the longer drip infusion instead of getting put under with the Versed and things like
exactly.
that. Okay.
But it's still a microdose when you compare it to what they're using in the ER, what they're using in hospice, what they're using in anesthesia. It's still a microdose.
Okay.
And just when it was termed an essential medicine in 1985, it was because it has such a low incidence of respiratory depression. That's why it's so favored in military and EMS, is because you're not going to not without an emergent situation, by not knowing someone's medical history, you're not going to potentially put them into respiratory depression.
Now, you've mentioned all this, 1985, this and that. The one thing I've known about you, Brent, is that you are an avid researcher when it comes to either resurrecting old treatments or literally cutting edge new treatments. You really researched ketamine. You really put your time in this, haven't you?
I was prepared to do ketamine for 2 years before I did my first case. So I was ready. And then it was 2 years after my first case that I did my first treatment on myself. And it wasn't that I was worried about it. I just didn't know I needed it until I learned more about it. But yes, I put a lot of time in because obviously in functional medicine, we don't have the luxury of open checkbooks to do research. And so our research is done through clinical observation trials, experiments on ourselves, and just smart research and as much evidence that we can find. But in a lot of cases, it's us digging and pioneering.
But you're a high-functioning guy. Always been a high-functioning guy. Doctor, bright guy, very motivated, in great shape, has always been in great shape. You did ketamine. What did it do for you?
Psychedelics are a way for us to take a look at ourselves without rejection. And everybody could be considered to have their own traumas, their own resentments, their own regrets. We all need a break because we never get a chance to reflect. No one usually takes the times for themselves that they should. So I think anytime you can get put into a position where you have 60 minutes of uninterrupted time to take a look at yourself from a different perspective, nobody is going to come out of there without some new information. Yeah, it's a way for us to, the way I always looked at it was that to me, ketamine infusions is really a betterment. I don't know if that's even a word, but that's the word that always would come to me. Ketamine it's a self-improvement tool. It's a way for you to figure out how you can be the best version of yourself. And by doing that, sometimes you have to step out of yourself to see what you are and what you're doing and how you're doing from what other people see you as. So that's the way when they talk about dissociation is stepping out of your own situation and taking a look from a different perspective. Now you're getting a look how other people interpret what you are doing and how you're doing and who you are. And then you start to figure out ways, I probably could do that a little better.
We're going to get into what the process is because I know some people are saying, okay, well, what does this mean? Let's talk about this. Is that when somebody gets their initial ketamine treatment? What can they expect in terms of how they feel? And what is the lasting effects, and how often do they come back for more ketamine, or is it a scheduled thing? How does that?
Yeah, I think the fear is the biggest problem with ketamine. And the way I look at it is that people are fearful to try psychedelics, but yet they will try pharmaceuticals that they recite all of the side effects, even their speedy voices at the end of a commercial. And those effects, this is a 60-minute treatment with a short half-life, quick in, quick out, and you're not going to have any of those long-lasting effects. So when people come in, I try to get them to understand is that you don't have to be fearful of the psychedelic experience because it's only 60 minutes, but you're also looking for change. There are people that come in here, there's something that they're trying to fix. There's something that they're trying to change, and you can't get anywhere without change. So if you're really here for change, wouldn't you want something that was pretty aggressive? Wouldn't you want something that you're gonna feel, that you're gonna be able to talk about? And so that's the big thing I do, is set the stage for people to understand you're coming in here and you want change. If you want change, don't worry about the intensity, worry about the outcome. And when that also is what limits how many treatments we're going to do. Depends on the person, depends on how aggressive they are going to be on themselves. Because remember, there's no magic pill in life, nothing. All that I believe that psychedelics can provide for someone is a shortcut. Because at the end of the day, if you want to be out of pain, you want to be in control of your happiness, you don't want to be depressed, you don't want anxiety, there's only one person that's going to get you there. And if once they realize that there's no way around it, nobody else is going to do anything, you're the only person who's going to do it, then they start to realize, going, oh, I better get to work.
Yeah.
And getting to work means you get into your treatments. And how I explain it is, so when people come out, they might need 5, they might need 10, they might need 15, they might need 30, but they won't be back here unless they know something's helping or something's working. When you can take someone with suicidal ideation and take away their suicidal ideation in 1 or 2 treatments, you know that there is some robust change that happens or is occurring within the brain to cause someone to want to have that big of a shift. They're not out of their depression, but at least they don't want to commit suicide.
That's awesome. So when you say lasting effects, I think I want to clear that up, because people at home may say, or think of effects 2 different ways. You mean that the effects of the ketamine, the dissociative feeling, the little bit of the mild hallucination, that goes away very quickly after the treatment. But the work that the drug does in the brain is ongoing and long lasting.
Yeah. Ketamine is a regenerative treatment. And so I usually explain it as 3 phases. The first phase is what people are there for on that first treatment, the first 5 treatments. They're getting these treatments very rapidly, and all they want is to come out with new perspective, take a look from another angle, and a little bit of hope. And then from that point on, it goes into the second phase, which is we're very aggressive about it isn't a magic pill. You need to do your work. If you want change, if you want an improvement, you got to work on yourself, and that's lifestyle. We give a handout of all the different things you can be doing to help your brain and to help yourself get out of this situation quicker. And the quicker that people get to work on themselves, the quicker they get resolution. And then the third phase is the regenerative side, because remember, the whole concept of ketamine is to work in the area of the brain that works on your sympathetic nervous system to balance out neurotransmission, but also to enhance brain-derived neurotropic factor, which then causes this neuroplasticity, which everyone talks about, or neurogenesis, which is the creation of new nerve pathways and new nerve cells, but most importantly, enhance the pathways that you have. And so when you think of it that way, when we look at the best successes, it's not the person I saw 10 years ago or in the first week. It's the one that you see after the 3rd month, the 6th month, 3 years later, and you see where these people are. Then you see the true regenerative state or the regenerative possibilities of ketamine. This is a process of basically putting something into movement, into change, and then that person has to take that responsibility. But remember, you can't make change until you see what you want to change into. So this is basically giving someone the hope, the perspective, and the vision that they're capable of anything. Then they get to work.
Now, so somebody that's going to go do ketamine, and when I say do ketamine, get a ketamine treatment, I apologize, in your office or in your clinics that you're opening up, what's the experience like? Can you, because there's some of that fear because it's the unknown. Can you describe the room, the setup, how it's administered, the whole thing, just so people can paint a picture so they're put at ease.
Yeah. So again, if you want change, you got to be ready to take a little bit of a risk. And this is a very low risk because, again, it's one of the safest anesthetics. It's a very safe drug. It's a microdose. It's monitored. We have a camera on you. We take your vital signs. We make sure you're comfortable going out. We have 10-inch memory foam beds or recliner, depending on what you want. It's a 60-minute infusion. We use an infusion pump. Smooth transition in, smooth transition out. Very comfortable, relaxing music, a mask. It's really a 60-minute therapy session. That's what you got to think about it, is that this is therapy. It's better than massage because you're not only getting a full mental and physical relaxation, but you're also getting to explore yourself. It's something that you can't really put words to, and most people can't put words to it because it's very individual. They're always different, but you have 60 minutes of time you do not get. You can't do it when you're sleeping. You never get this type of peace and quiet to reflect while your brain's in a malleable position and all your important neurotransmitters are all peaked, and you hit this point where you can actually look at yourself and do that without rejection. Because there's this thing called our ego, and that's what they talk about ego death, is that some people try to help themselves. They try to do this when they're not in a therapeutic setting and they got their ego in place, and you know what? They can talk themselves out of anything. That's why counseling is very hard too. Because now you got two people trying to get to a root cause of some sort of thought processes or these ruminating thoughts. But if the one person doesn't want to let it out, they're not. And if the counselor can't find a way to get into it, they're never going to get their answers. And that's why counseling has been going on for years, and yet we have a rise in every area of mental illness.
You mentioned something, you've used the term a couple of times, and I don't want people at home to suffer from more cursive knowledge. You know what microdosing is. I know what microdosing is. And we've used it both in conversation, but I just realized that they don't know what microdosing is. So can you explain real quick what a microdose is?
Yeah, so microdose is a normal therapeutic dose of anesthesia for ketamine is 4 to 5 times higher than what we would be using as a starting dose for ketamine. And microdoses in psychedelics, for instance, for a therapeutic dose of some of the other psychedelics, it would be a tenth of what we would be using as a therapeutic dose would be a microdose. And all it means is you're doing a dose that isn't going to the full extent of what the medicine is supposed to do.
Okay.
So full anesthesia means you're out. So we're doing a microdose of anesthesia. So we're putting you into a sub-anesthetic situation to where you're not out, but you're in this in between.
Now, what would you say, with your knowledge as the medical director of the detox, to people that you hear them say, oh, these clinics are just popping up. It's an illegal way for people to go in there and just get high or take a trip or whatever. How would you combat that?
One of the leading causes of admissions in an inpatient detox center is alcohol. But I never see anyone talking about alcohol and, oh, wait a minute. You're going in to do an alcohol treatment? Wait, I've heard that you can get addicted to that. No one thinks about it that way. But in my history of drug detox, and I'm sure this is very consistent with other detox centers, is we never had one admission. 0 admissions in 15 and a half years. Very aggressive inpatient detox center. Inpatient. Not one admission for ketamine in 15 and a half years. And not one admission for any psychedelics. Since ketamine is not a drug of addiction, it's a drug of use. And it could be even termed a drug of abuse. But they're not getting addicted to it. They're choosing to use this drug for whatever recreational purpose that they want to, but it's not something they're getting addicted to, and it's causing them to have a disruption of their life. It's just, I'm not saying it can't, but in the circumstances that what would be called ketamine or special K, being a cause of addiction type or substance abuse disorder would be almost always combined with another drug that has a high incidence of addiction, because it just hasn't been seen.
Okay, it's safe. It's not addictive, and people that are coming here are coming for help, not just to get high. I've seen it because I have a disability practice. So people that are injured and can't work anymore, they come to me and I help them get disability. And it's just amazing that I've seen more of my clients that have, especially my veteran clients or veterans, armed service veterans, transition back to work by getting off some of these really high dose psychiatric medications and pain medications and taking alternative treatment. Don't take this as Brent and I telling you to go and flush all your pharmaceuticals down the toilet tomorrow. We're not saying that. But as a part of a quality program with a knowledgeable provider, I've seen my clients go from being disabled to being able to go back to work, to stop living in the woods with PTSD and come back because they've stopped drinking, they've stopped taking these medications, and they've started doing things like medical marijuana or other type of ketamine treatments, which in combination with lower doses of their other medications made them functional. Is that consistent with what I've seen in my practice? Is it consistent with what you've seen in your practice?
No, absolutely. When it comes down to quality of life, just being able to perform activities of daily living, it should be everybody's number one project. It doesn't matter if you're disabled. It doesn't matter if you had a unfortunate accident or unfortunate situation that's put you into a disabled situation. You're still alive. You still have to have a quality of life. It should be a nonstop project for you to figure out every possible way that you can improve that quality of life, and without it, whatever means necessary. And for people not to look at alternative medicine, it's silly, because just as you said, all you're trying to do is improve function. And if you can go to a plant-based solution, ketamine is synthetic, obviously, but there are cannabis and psilocybins. These are options that are organic. And we can break them down naturally. Cannabis has an endocannabinoid system in our body internally. So for people not to explore different ways to manage pain, manage thoughts, manage sleep, it's really silly in my mind, because all of this has been researched in the 50s and the 60s, the 40s, 50s, 60s, and there's thousands of research articles to support that these therapies might all sorts of different systems to reduce our needs for pharmaceuticals.
So awesome. Now, we had mentioned before that you do ketamine in your office, but you also are opening up clinics across the state, across the country for ketamine treatment. When's that happening? What's the name?
Yeah, it's called Neurotropic Wellness, and we'll be open our first one in first quarter of next year.
That's awesome. And
it's not just ketamine; it's all psychedelic medicine, and it's going to be centering on what's legal, which is cannabis and ketamine, but psilocybin should be, and MDMA is another one that's already on the docket for legalization for PTSD, but psilocybin is going to be moving pretty quickly, and that's the one that I predominantly want to use because it's organic.
Awesome. We're gonna wrap this up here. We want to thank Dr. Agin for being with us today. He's just, as you can tell, a wealth of knowledge. I know he was holding himself back because he could talk about this all night. In fact, I've been there when he talked about it all night, and it's always so enlightening. And that's how I got to know a lot of this stuff for my disability clients, talking to them about first when medical marijuana was coming on. Hey, go get your card, go try it, go see it. And all of a sudden you saw them and their spouses say, he's not a zombie anymore, because he's able to sleep because of this and get a little pain relief because of the medical marijuana and the cannabis. He's lowered his other doses, and now during the day when my kid talks to him, he's not a blank sheet. Yeah. We've really seen that. So this is really helpful. But we're going to end this right here. Now, there's going to be another series of this that's going to be posted where we're going to talk about true psychedelics and MDMA and mushrooms and things like that. So please find that one, because that's going to be really interesting. But until then, I'm Bill Demas from Herman Wells. If you have any questions about this or any disability issue or any legal issue, give us a call, 727-821-3195. Thanks again, Brent.
Absolutely.